Good morning, afternoon, or evening, wherever you're tuning in from. I'm Dr. Melinda Ring. Today, we're diving into a topic that touches each and every one of us, the food we eat and its profound impact on our longevity and overall well-being. I'm excited to share with you not just the latest evidence-based insights, but also just a holistic perspective that honors food as more than just fuel. It's a cornerstone of our health, our culture, and our individual lives. Let's start by remembering the sobering fact that chronic diseases like heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. And all of these are greatly impacted by what we eat. In fact, the U.S. Burden of Disease collaborators reported that out of the 17 top risk factors in this country, dietary factors are the #1 cause for premature death and #3 for disability, more than smoking, drugs, or being sedentary. And the Global Burden of Disease study that included 195 countries concluded that improvement of diet could potentially prevent 1 in every 5 deaths globally. So clearly, we need to pay attention to diet if we want to live long, vital lives. But today, we find ourselves in a landscape that's saturated with an array of longevity diet approaches, each championed by a different health expert. These experts oftentimes present conflicting evidence. Some advocate for a ketogenic diet high in proteins. Others caution against excess protein intake. Some recommend a vegan lifestyle, while others extol the virtues of fish or grass-fed meat. And then there are those who suggest that what you eat may not matter as much as when you eat in terms of the key to longevity. So how can we navigate this labyrinth of dietary advice? And equally importantly, how can we make informed choices that honor the multifaceted role of food in our lives, not merely as food and fuel, but as a source of pleasure, connection, cultural expression, and well-being? Food is a rich tapestry woven into the fabric of our lives. And I believe for a diet to be a long-lasting and realistic option, we need to find one that brings health and joy to your life. To figure out the best foods for living a long, healthy life, we first need to understand why we age. A recent publication outlined 12 key reasons our bodies show signs of aging, from changes in our DNA to how well our cells talk to each other, and then some common areas that we address in integrative medicine, like chronic inflammation and dysbiosis. These factors collectively influence how our bodies age and respond to dietary choices. In essence, the aging process involves complex interactions between our genes, our metabolism, and our cellular functions, all of which are influenced by what we eat. Now, it's fascinating how wisdom transcends time. Long time ago, Hippocrates advised us that the safest way to health was by finding the right amount of nourishment and exercise, not too little and not too much. Fast forward to today, and we see a similar message echoed in Michael Pollan's simple yet profound mantra: eat food, not too much, mostly plants. Both pieces of advice remind us that the essence of a healthy life lies in balance and simplicity. In a world that's filled with dietary extremes and confusing advice, these timeless principles offer us a clear path to better health. Now, let's briefly look at the science for these 3 tenets and then consider how can we translate research from the bench to our kitchen table. We'll start with eat food or eat real food. Need another reason to skip junk food? A study found that eating too much processed foods like microwave meals and sugary drinks and chips can actually shorten your life. The study followed 45,000 adults and found that those who ate more of these foods had a higher risk of dying early, especially from heart disease and cancer. Why is this? Well, processed foods often have less nutrition and more sugar, salt, and unhealthy fats. Plus, they are packed with additives that just aren't good for you. In fact, some countries are actually putting food label warnings on packaging. So what do we mean by real food? Well, it's helpful to think about these 4 different categories. There's the first category where we would love to be the unprocessed or minimally processed foods like fresh fruits and vegetables. Group 2, these are processed culinary ingredients like oil and sugar. Then we get to group 3, which are a little more processed, like canned vegetables, bread, and cheese. And then group 4 is the ultra processed foods. That's where those things like the microwave meals and sugary drinks and things that last on shelves for a long time live. So for a long, healthy life, cut back on those ultra processed foods. Remember, the closer your food is to nature, the better. Now, number 2, moderation is key and science agrees. Let's delve into the research that supports the benefits of caloric restriction or eating not too much. Studies have shown that caloric restriction, as long as we don't get to malnutrition, is the most effective non-drug approach to extend lifespan, and not just in animals, also in humans. Caloric restriction has also been found to improve different metabolic pathways. It optimizes mitochondrial function, our energy production in the cells. It reduces harmful oxidative stress and lowers inflammation, all of which contribute to a longer, healthier life. Now, sometimes the best insights come from the smallest creatures. A compelling mouse study looked at the effect of ad lib eating. Essentially, the mouse could eat whatever it wanted, compared to a calorie-restricted mouse. The mice that ate freely showed signs of accelerated ages. You can see that gray mouse on the right, while the calorie-restricted mouse at the same age maintained better health and showed fewer signs of aging. While we can't directly translate mouse studies to humans, the findings do add to the growing body of evidence that not too much is more than just good advice. It's a pathway to health. But cutting calories on a daily basis may be too hard for some people. So scientists are on a quest to find easier ways to get the same health benefits. A recent NIH workshop brought together leading experts who are investigating how our dietary composition and different feeding times can promote healthy aging. In the report that summarizes its key findings, it states a calorie is more than just a calorie. Quality, not just quantity, matters. Calories from different types of amino acids and carbohydrates can have different impacts on healthy aging, as can consuming foods at different times of the day, whether or not you're fasting. And there's a lot of buzz around different ways to fast for better health, and whether when you eat matters more than what you eat. Some people try an evidence-based special fasting mimicking diet for 5 days each month, while others use eating windows, like eating for 8 hours and then fasting for 16. There's also growing interest in syncing your meals with the body's natural clock or our circadian rhythm. Now, while the jury's still out on whether intermittent fasting helps with long-term weight loss, it does seem to offer other health perks. For example, it can make your cells more efficient, almost like a tune-up for the body, and it can help with things like blood sugar control and even repairing damaged DNA. Also, eating earlier in the day and when the sun is out and avoiding late night snacking seems to be a good idea for our overall health. One simple but powerful concept that helps us avoid overeating comes from Okinawa, Japan, known as one of the blue zones where people live exceptionally long lives. That concept is Hari Hachabu, which means eat until you're 80% full. Instead of cleaning your plate, aim to stop eating when you're just satisfied, not stuffed. Now, this is where mindful eating comes into play. It takes about 20 minutes for your stomach to tell your brain it's full. So if you eat too quickly and without thinking, you might end up eating more than you need. The advice here is to slow down and give your body a chance to catch up with your mind. And lastly, mostly plants. Eating more vegetables and fruit isn't just good advice, it is backed by science. Let's look at 2 recent studies that support the power of a plant-based diet. Now, one study found that the more servings of fruits and vegetables you eat, the longer your telomeres tend to be. What are telomeres? They're the protective caps at the ends of our DNA. And the longer our telomeres are, the longer we are living. Another review concluded that a well-planned plant-based diet, occasionally supplemented with fish and lean meat, also offers health benefits. These include better metabolism, improved heart health, and a healthier gut, all of which contribute to a longer, healthy life. Plant-based diets are not a trend. They have real science backing their benefits for longevity. Plants are rich in antioxidants, which help fight off low-level inflammation in our body. Certain plant foods are rich in compounds that help protect our DNA from damage, much like a shield. A plant-based diet is also high in fiber, which is excellent for your gut. And a healthy gut influences everything from your mood to your immune system. Plants help regulate your body's use of sugar and fats, keeping metabolism in check. Some plants even activate autophagy, your cell's cleaning system, helping them remove damaged parts that can accelerate aging. And we also know that compounds in plants like cruciferous vegetables have been shown to inhibit the growth of cancer cells, while foods like berries and leafy greens protect against cognitive decline, helping your brain stay sharp as you age. So let's recap what we've learned today about eating for a longer, healthier life. Include more fruits, vegetables, whole grains, and plant-based proteins. These foods are nutrient dense and support various aspects of health. Mindful eating, practice that Hari Hachabu, we're eating until you're 80% full, and pay attention to your body's natural clock, eating when the sun is out. Consider intermittent fasting or time-restricted eating, but consult your healthcare provider first. Plan your meals again for when the day is out to align with your circadian rhythms, and don't over-restrict your diet. To get all the nutrients our body needs to function, we need a wide variety of foods. Science also tells us that we should limit or avoid ultra-processed foods, sugary drinks, excess salt, calories, alcohol, and excess animal products. These can accelerate aging and increase the risk of chronic diseases. By combining all of these strategies, you're not just eating to live, you're eating to thrive for years to come. As we wrap up today, let's not forget the ancient wisdom that food is medicine. What we choose to put on our plates can be the most powerful form of healthcare. By making mindful, evidence-based choices, we're not just fueling our bodies, we're nourishing our souls and investing in a future of vibrant health and longevity. Thank you for joining me on this journey toward better health through smarter eating. If you'd like a free handout that explores more of what we talked about today about diet and longevity, go to drmelindaring.com and you can download it. Thank you for attending our symposium.
Hi, my name is Wu-Hsun Tom Yang. I'm currently a teaching associate here at University of Washington, Osher Center for Integrative Health. Today, I will be discussing some of the evidence behind commonly used longevity and anti-aging supplements to see if they actually work. First is curcumin, and this is an active component in turmeric. Its claim of fame is in improving muscle and joint health. Current studies suggest that curcumin is indeed helpful for arthritis, especially for osteoarthritis of the knee. It has also been shown to be helpful in affecting pain, as well as reducing the number of swollen and tender joints in patients with rheumatoid arthritis. However, when compared to commonly used pain medications such as ibuprofen and diclofenac sodium, the effect is not superior. Keep in mind, though, that these pain medication over-the-counter or prescription often carry a larger side effect profile, whereas curcumin itself is well tolerated and has much less side effects. Curcumin is also well known for its anti-inflammatory effect and is a promising adjunctive therapy in treating disease that comes with high inflammatory biomarkers. These diseases are non-alcoholic fatty liver disease, dyslipidemia, metabolic syndrome, osteoarthritis, as well as migraine headaches. Its anti-inflammatory effect is most likely more pronounced in older individuals, so greater than 45-year-old is what as the study has shown, and it is also not dose or duration dependent. What does that mean? That means whether you're taking a low dose or a high dose of curcumin for long duration or short duration, it will exert its anti-inflammatory effect. It is also a well-known fact that curcumin or turmeric on its own is not well absorbed or bioavailable in our blood. So choosing a supplement that binds curcuminoids to another compound that increase its bioavailability and absorbability would be the most ideal. Next, we have CoQ10. Coenzyme Q10 is a known antioxidant that helps our mitochondria in our cell produce cellular energy, or ATP. It appears in high doses in the heart, kidney, and liver, and as well as pancreatic cells. As we age, the level of CoQ10 in these cells naturally decline. And most of the commercial form of CoQ10 come in the form of ubiquinone, which is the oxidized form, and it gets converted to the reduced form ubiquinol in the body. There are commercial products that has ubiquinol available. However, a lot of these studies done on ubiquinol or comparing the two are funded by the industry, so there's a high funding bias in these studies. So CoQ10 does indeed provide a multitude of cardiovascular benefits, especially in patients who are at risk for coronary artery disease. So studies have shown that CoQ10 improves the ability for the heart to relax in patients who are taking medication, like statin medication, to lower their lipids. It also is beneficial for those who are taking antihypertensive medication in reducing blood pressure, both systolic and diastolic, as well as improving lipid profiles, for instance, increasing HDL and lowering LDL. Its antioxidant effect may reduce oxidative stress to our heart and arteries, and that is how it prevents future cardiac events. Additionally, it is currently being studied for other pain conditions as well, such as fibromyalgia and migraine headaches. Next, we have alpha lipoic acid, or ALA. This is the antioxidant that we make in our body and also can be found in multiple food resources as well. Current research actually shows that in patients with metabolic disease, such as diabetes, PCOS, and metabolic syndrome, ALA may actually improve how our body utilizes glucose and insulin. It also lowers total cholesterol and LDL. However, it does not lower triglycerides after supplementation. Although it has been studied for weight loss, the weight loss effect is relatively small and only present in individuals who are overweight or obese. So some of the online resources have claimed that it increased cellular energy and like in our mitochondria. However, this is actually not correct. It does not act like CoQ10. And so this is an unsubstantiated claim. Next, we have resveratrol, and this is a well-known antioxidant. It's often touted for its anti-aging effect. It is found in red wine, red skin grapes, and also many of the dark berries. Studies have shown that it promotes mild weight loss in those who are overweight and obese, but does not improve some of the metabolic parameters that are accessible through labs, such as the ones that we have mentioned in previous supplements. Although many of the websites do claim that it slows down aging by activating enzymes that are present or activated when we're in a caloric restrictive state or fasting. However, most of these studies are actually done on animals or in laboratory settings on human cells. So relatively few human trials exist, and there's no robust data that actually supports its use for anti-aging or longevity currently. Next, we have magnesium. This is a commonly used mineral, and it's essential to many of our cellular functions as well as bone turnover. Although these often used over the counter for relieving constipation, there are many studies that use magnesium for other purposes. One of the claims is that it actually has a mood stabilizing effect. However, current evidence is actually strongest in higher intake of magnesium through diet in observational studies. And these are studies that observe population through a long period of time. Supplement alone does not seem to have the same effect in preventing depressive symptoms. Furthermore, in individuals, this is a confounding factor, in individuals who are actually having mood disorders or are taking psychiatric drugs, their serum magnesium are actually higher than controls already. So more needs to be done to study how magnesium supplementation may be helpful, or as the studies have shown that dietary magnesium is the way to go. For bone health, magnesium, again, higher dietary magnesium intake rather than supplementation is helpful in increasing bone mineral density, especially in postmenopausal women with osteoporosis. Last but not least, not all magnesium are created the same. So you may have been recommended magnesium, not for constipation, but for other things. Currently, there are studies done for magnesium L-threonate, and it's being studied for its effect on improving cognitive abilities. And this is partly because it is more bioavailable in our body, and also it readily crosses the blood-brain barrier. I shouldn't say readily, it's probably more efficiently compared to some of the other magnesiums available on the market. Next, we have collagen peptides. And so these are peptides that are derived from animal collagens from skin, scale, bone, tendon, ligaments, as well as other connective tissues. So evidence of collagen peptides' ability to improve skin integrity is actually quite robust, and it supports the claim that collagen does, in fact, improve skin hydration, elasticity, as well as reducing wrinkles. However, assessment in clinical studies oftentimes does not match the real-life reality when they actually do customer satisfaction or consumer satisfaction who are taking collagen. A lot of times the satisfaction is not as high as some of the studies would have us believe. And this is because a lot of the changes might actually be so little and not cosmetically visible to us. And so there are also a lot of studies done on combination product that has collagen as one of the components. And these studies often have mixed results. And it's also difficult to tease out whether it's the collagen peptides are actually doing the work on skin integrity, or if it's the other constituents in these supplements. All right, next we have green tea extract, or EN, or EGCG. So EGCG stands for epigallocatechin gallate, and this is actually the most abundant polyphenol or catechin in tea, especially in green and white tea. And these are often included, one or the other are often included in weight loss supplements. And so the most recent study I was able to find actually found that green tea extract does not affect fat absorption. It does not affect resting energy expenditure. What does that mean? That means the energy that we spend when we're not doing much, and as well as body composition, including BMI in adults. So more study definitely needs to be done on its effect on weight loss and fat loss. Most of the study observationally has been done on people who drink green tea or use green tea supplements in Asian populations, which may have very different, body composition compared to the population that here in the United States. However, for cardiovascular health, drinking 1 to 4 cups of green tea, not necessarily taking the extract or EGCG, has been proven to actually help reduce the risk for coronary artery disease. The other thing that I want to mention when it comes to green tea extract is that it does have a potential for hepatotoxicity when taken in high doses, and especially in people with existing liver disease. So please be careful of that. And also in high doses, green tea extract may have a lot of caffeine, which may not be appropriate for individuals with hypertension, insomnia, or other types of arrhythmias. Right, so we barely skimmed the surface of a lot of the anti-aging and longevity supplements that are out there. So when you're looking at a supplement, how do you know if their claims are too good to be true, whether it's online or in the stores? So here's some of the red flags to watch out for. First, if the article is published or sponsored by the supplement company, which you can usually find at the end of a research article, whether there's a conflict of interest stated. If the claims are too vague or too generalized, and so that could be a potential red flag as well. If there's no reference cited at the end of the article, that's also another potential red flags. And if they do include links for you to click on to actually link to the reference where they get the statements, make sure to check them out and see if the study actually claim what the article claims and they actually match up. Otherwise, there are actually a lot of articles out there where there's a mismatch. And so the article that they cited does not substantiate the claims at all. Of course, many of the supplements do carry their own side effect profiles and may not be appropriate for you because of existing conditions or the medications that you're taking. So whenever you're in doubt, please consult a healthcare professional who are knowledgeable about these supplements before you start taking them. Here are some of the resources I've cited for today's presentation. Thank you for your attention. I hope you learned something about some of the commonly used and advertised anti-aging and longevity supplements out there.